I just want to mention in the beginning that any views I express, to the extent that I express any, are my own and really don't represent the views of the whole HHS Pain Management Task Force. So first slide. Okay, so in the beginning, I just want to get everybody on a level playing field. I realize that some people may be just sort of tuning in to what this report is. And so the first three questions will be kind of a review, and then we'll cover some new ground. So I'm going to go over why the report was created, what was the charge that Congress gave the task force, who created it, what's in it, what happened at the last meeting that we had the week before last, what my views are of the successes of the effort, and then what are some concerns I have about it, what happens next, and what you can do to help, and then we'll take questions. Next slide. So why was the report created? The Pain Management Best Practices Interagency Task Force, kind of a mouthful, grew out of the Comprehensive Addiction and Recovery Act, which was the first major opioid legislation that Congress passed in 2016. It was Section 101, the first section in the Act, and it's the only section that pertained to pain management. Congress really wanted to know what pain experts consider best practice in pain management now, and it was overseen by the Secretary of Health and Human Services. Next slide. This is the specific legislative language, so you understand exactly what the charge was. The Secretary of HHS, in cooperation with the Secretary of Veterans Affairs and the Secretary of Defense, shall convene a pain management best practices interagency task force. The task force shall, 1, identify, review, and as appropriate, determine whether there are gaps in or inconsistencies between best practices for pain management, including chronic and acute pain, developed or adopted by federal agencies, and 2, not later than 1 year after the date on which the task force is convened, under subsection B, propose updates to best practices and recommendations on addressing gaps or inconsistencies identified as appropriate, and submit to relevant federal agencies and the general public such proposed updates and recommendations. So this was a cross-government effort. So included on the task force are representatives from all the federal health agencies, and as well as the Department of Defense and Department of Veteran Affairs. Next slide. In plain language, basically the task force charge is to update best practices and recommendations on pain management for the nation, including relevant federal health agencies such as the Center for Disease Control and the Food and Drug Administration. Next slide. So who created the report? This is a picture of all the task force members. The legislation was very specific about the types of experts that should be chosen for the task force. A panel of 29 members were appointed by the U.S. Secretary of Health and Human Services, Alex Azar. The chair is Vanilla Singh, who is the Chief Medical Officer for the Office of the Assistant Secretary for Health, Admiral Gregoire, and she is a pain physician. I was the only patient and pain advocate appointed to the panel. Most of the other members were doctors. Next slide. So the report is broad. It covers a whole range of topics. The most current version that is up on the website of the Pain Management Task Force is 112 pages. That includes the references and some resources and some graphics. It covers acute and chronic pain. It covers medication, including sections on risk assessment and overdose prevention. Restorative therapies, these are just a few of them, PT, OT, exercise, and others. Interventional procedures, nerve blocks, epidural injections, neuromodulation, and many others. Psychological interventions, including behavioral therapy, cognitive behavioral therapy, mindfulness, meditation, stress reduction, and others. Complementary and integrative therapies, again, these are examples: acupuncture, massage, yoga, and others. Consideration of special populations. So there were sections on pediatrics, on women, on the military, on underserved populations, and others. Section on stigma, education, including public, patient, provider, as well as policymaker education, access to care, including medication and workforce shortages, insurance coverage, and others, and also a review of the CDC prescribing guidelines. Next slide. So overall highlights, these are just overall themes of the report. It begins with reiteration of the huge problem of pain. Pain is an enormous public health problem with profound individual and societal consequences. Next slide. The importance of individualized care is stressed throughout the entire report when it comes to pain. Successful management of pain requires individualization of care in selection of therapies, in consideration of risks and benefits, in the duration of treatment and optimal dosing of medication, and in everything else. Next slide. Multidisciplinary care is stressed throughout the report. That best practices in pain management is really achieved through combining many different therapies, including a full range of pharmacological and non-pharmacological treatments. I often say that if each therapy that you try takes down your pain another 15%, when you add it all up, you get a reduction in pain such that hopefully you will be able to function reasonably well. Next slide. Stigma, I'm glad that the report took on the topic of stigma. It's a huge one. It's a barrier to treatment. So I think it's really critical that we provide education and an awareness that pain is a disease when it becomes chronic in itself, and that providers have empathy and a non-judgmental approach to treatment. Next slide. Education, as I mentioned, is important, including the public, patient, provider, and even policymaker education. It's crucial to delivering effective patient-centered pain management and is really necessary for optimizing patient outcomes. Next slide. In particular, when it comes to opioids, that an individualized approach is really necessary. The report acknowledges that opioids have a place in pain management, that the risk-benefit analysis depends on each person when it comes to opioids, and that there's a wide variation in factors that affect the optimal dose of opioids. Next slide. The real substance of the report, the real meat of it, are the recommendations. And I would suggest, if you don't want to read the entire report, that you focus on those recommendations as opposed to the narrative. You familiarize yourself with those recommendations and choose ones that are really the most important to you. So when you discuss this report with your representative or whomever you are educating about pain, when you get the opportunity, you can zero in on what you think are the most important recommendations. Next slide. So we had our final meeting of the week before last on May 9th and 10th. The purpose of the meeting was really to summarize the report and the extensive public input that we had, and then take a vote on the final draft. The report would be moved forward if there was a simple majority, but out of the 29 appointees, 27 said yes. One was opposed, which is the Office of National Drug Control Policy at the White House, and there was one abstention. The CDC abstained. And the agenda included, I think, very impactful patient testimonials. They were a part of every one of our 3 meetings. An open public comment period, again, a great opportunity for patients as well as other stakeholders to comment. There were comments from 2 physician Congress members, Dr. Cassidy and Dr. Burgess, and also comments from the presidents of 2 prominent actually 3 prominent physician groups. 2 of them were present and 1 was on the phone. The president-elect of the AMA, Patrice Harris, the president of the Association of American Physicians and Surgeons, and the president of the American Academy of Neurosurgeons. Next slide. So what are the successes of the effort? In my opinion, the high visibility that pain had, HHS leadership was really focused on it. Attending some of our meetings were the highest health officials in the government. Secretary Azar actually attended our first meeting. Secretary Greg Ware, who was the Undersecretary for Health, attended some of our meetings, and he did a video, sort of a video appearance at our last meeting since he was at another meeting. Members of Congress spoke at all of our meetings. There was an enormous public response. 9,000 comments was huge. 6,000 just on the report alone, and the others coming in open periods around our meetings. And of course, many people watched the live stream of the 2-day meeting. The focus on patients, was at every meeting. I think in the report, the testimonials, I believe, were really impactful. The purpose was really to put patients front and center. The open public comment periods also allowed many patients and patient advocates to speak. I think another success was the real main message of the report, which is that individualized care is really essential in pain management in almost every aspect of pain, in the treatment plan, in the choice of therapies, in risk-benefit analysis, in medication choice and dosage. There's no one size fits all when it comes to pain. Everybody reacts slightly different to these therapies. And I think the overwhelmingly positive response to the report from patients, from healthcare professionals, from organizations, from corporations that are in this space. There was strong endorsement from mainstream physician groups, which is huge, especially the AMA, which put out a press release on the first day of our last meeting, and also the AMA president-elect, Patrice Harris, who in comments said these recommendations are a lifeline to pain patients who have been caught in the middle of policy efforts that have produced harmful unintended consequences. So those endorsements were absolutely a huge deal. Next slide. So what are my concerns about the effort? One concern I have is that HHS was really unwilling to call for a revision of the CDC guidelines. The report included a review of the guidelines and pointed out a number of problems with them, especially the dosage limit. But HHS would not go further than that. And consequently, I think it is unlikely that the CDC will actually change the guidelines. Also, no one entity is really charged with implementing the recommendations, so there's little accountability that HHS is actually going to follow through on the implementation. That's where we come in, and we'll talk about that later. I did issue a call to action during the meeting saying that the report was really great, but at the end of the day, it really is just a piece of paper or a computer file unless it's implemented. So I asked task force members to do 2 things. The first, speak to their congressional members and ask for a hearing on the report. Hearings are highly visible events on Capitol Hill. They're covered in all the news media. The evening news often includes scenes from hearings, congressional hearings. They focus Congress's attention on recommendations. And so it would be really terrific if we could get a hearing on the report in the next few months. And then I asked members to really choose a recommendation or some section of the report that they cared a lot about and try to move it forward in any way they could. Some of the members did talk about how they had already started to move some of these forward. Mark Rosenberg, who is a doctor, spoke about how he had started a new program at his hospital in New Jersey, focused around the report and its recommendations on pain. Another member, Dr. Amanda Brandow, talked about her initiating a pediatric guidelines for pain. So these members are people that have influence, and I really wanted them to not just go back to their day job, but commit to doing something to move the recommendations forward. Next slide. So what happens next? So that's the big question, right? The final report, there were some changes spoken about at the meeting. The final report will be issued on May 30th. The committee actually has a deadline. The Congress allowed 1 year to get the report done. Now, the task force also, when we were in Washington, met with CMS, the Center for Medicaid and Medicare Services. In the SUPPORT Act, which was a piece of legislation that was signed last October by the president, the second large legislation, opioid legislation, Congress asked CMS specifically to collaborate with the Pain Management Task Force on an action plan to address the opioid crisis. And included in that action plan were stipulations about acute and chronic pain. So a review of payment and coverage policies to manage acute and chronic pain and minimize opioid misuse and abuse. Recommendations for new models of care to be tested by the Center for Medicare and Medicaid Innovation. A review of beneficiaries' access to other therapies that manage acute and chronic pain. And by that, they mean non-opioid therapies, including those in rural or underserved communities. And a review of payment and coverage policies related to medical devices for managing acute and chronic pain. So those are very much in sync with recommendations of the task force. Many of the recommendations relate to payment and coverage policies, reimbursement policies at CMS. Often CMS makes changes and other private insurers follow. So CMS is a real bellwether for changes in coverage and reimbursement. So that's, I think, a really important next step. Next slide. So the CMS action plan that was included in the support legislation, I think, as I mentioned, I think it's good news that the Pain Management Task Force is going to have input into that CMS action plan. Many recommendations, as I said in the report, involve better coverage and coordinated care, complementary therapies, and also compensation for more time spent with pain patients. We know that it takes more physician time to deal with something as complex as pain, and they just don't have the time in current practice. And so oftentimes, pain patients are not given the access to therapies that might help them. They don't have the time with the physician to really help initiate those. And physicians don't have time to check back with their patients, and many are just not turning away pain patients because they take too much time and effort. So if CMS would grant codes for more time spent with patients, I think it would be very helpful. CMS must also hold a public meeting to solicit comments on the action plan, and must also issue an RFI seeking public feedback on that plan. So I think that is one way for us to move some of these recommendations forward, by participating in activities that CMS will engage in over the next several months. So stay tuned to us at US Pain. We will notify you of opportunities to provide your ideas and feedback on how CMS could help improve pain care. Next slide. So what can we all do to help? I think really now is the time to educate and advocate. Educate your federal lawmakers about the importance of this report to you, why it means something to you, why better pain care will impact your life and those of the people you love. Advocate for a congressional hearing on the report. All of us have the ability to speak to our representatives. They're there because of us. They're there to serve us. And so I think it's an important time to ask them for some help. Congress mandated and paid for this report as part of CARA. Better pain management is part of the administration's 5-point strategy for combating the opioid crisis that is repeated in the press and over again. And so It's very important for Congress to act on this. The Health Committee recently held a hearing on the challenges of managing pain during the opioid crisis. That was in February. It actually is still available on their website, so you can listen in to some of the concerns of Congress members and why they had that pain hearing. They, surfaced problems in pain care. They should really want to address them, or why did they hold the hearing? So the way to address those really is they had an expert panel give these recommendations. Congress should be interested in hearing about and implementing those recommendations. Next slide. So the committees of jurisdiction really on these health issues like pain in the Senate is the Health, Education, Labor, and Pensions Committee. That was the committee that held the hearing on pain in February. And also in the House side, the Energy and Commerce Health Subcommittee. So we at US Pain will create 2 action campaigns, and you can then use those to contact your lawmakers. When you do contact the lawmakers, if you do call, it is perfectly fine to work through aides. It is rare that you actually get to speak with your representatives, but the aides are tasked with bringing back constituents' concerns to representatives. They care about their voters, and it's fine for you to follow up with an aide and then recontact the aide and see what response the lawmaker had to your asks. So next slide. The Senate Health Committee members are here, so you can see whether or not any of you live in the states of these senators. So Lamar Alexander is really the chairman, and Patty Murray is the ranking member, and they have a very good relationship. It's a bipartisan committee for the most part. Mike Enzi is from Wyoming, Bernie Sanders, Vermont, Richard Burr, North Carolina, Bob Casey, Pennsylvania, Johnny Isakson, Georgia, Tammy Baldwin, Wisconsin, Rand Paul, Kentucky, Chris Murphy, Connecticut, Susan Collins, Maine, Elizabeth Warren, Massachusetts, Bill Cassidy, who is the physician who spoke at our last meeting, is from Louisiana, Tim Kaine, Virginia, Pat Roberts, Kansas, Maggie Hassan, New Hampshire, Lisa Murkowski, Alaska, Tina Smith, Minnesota, Tim Scott, South Carolina, Doug Jones, Alabama, Mitt Romney, Utah, Jackie Rosen, Nevada, and Mike Braun, Indiana. If you live in one of those states, we urge you really to call your senator, and we will provide some talking points and let them know that you care about this report. Many reports come out that Congress mandates, but we want this one to get a lot of attention. It did get a fair amount of attention at the meetings, but in order to make this continue to live on and get them implemented, we need Congress aware of them and asking for a hearing. Next slide. And on the House side, the Energy and Commerce Health Subcommittee members are these. I won't read all of these, but Anna Eshoo is the chairperson. If you happen to live in her district in California, and Michael Burgess, again, he's a physician. He spoke at this last meeting of the task force. He is from Texas. If you live in either of those 2 districts, be really important for you to write and call them. And then these are all the other states that have specific districts that these people represent. And these are all on the Health Committee. It's a large committee, and it'll be important if any of these are your representatives for you to write and call. Next slide. So we basically compiled all the states. This represents 37 states. So a big chunk of the country is represented by these senators and representatives, and these are the people to ask for a hearing. Next slide. So as I mentioned, we are going to initiate 2 action campaigns, but there's no reason you can't get started yourself. This is where the handouts come in. So there's on the side of the screen on the panel a little panel that says handouts. If the panel isn't available, then click on that little triangle next to the word handouts and it'll open up. You can download this slide anytime during this live presentation, and you will have the links on that slide to these two engagements. The first one is a general email campaign, for constituents in all states. So there's no reason why you can't do this email letter to your congressperson and ask them to inquire about a hearing, put some pressure on the people on the health committees to have a hearing on something that's important to you as a constituent. And then the second one are some steps and talking points specifically for constituents that have representatives in states on these key committees, those 37 states. So if you're living in one of those 37 states, we are asking you to actually call and speak to, you can ask to speak to a health policy aide, say you are a constituent. Those are the magic words. Make sure that you initiate the call by saying you're a constituent. Next slide. So my real main message is that your voice matters. It is time to speak up now. Part of the implementation, part of the responsibility for implementation really resides with us and the pain community to be really active and speak up. The more constituents who call or write in, the greater the chance is that they're going to act. They will know this is something of importance to their constituents. You can get your family and friends who are constituents to do the same. We all know that pain really takes a village to manage, right? So people living with pain rely a lot on their family and friends to help them. I'm sure your family and friends know about your pain condition, and I think it's really important for them to get active as well. We have a great opportunity with this report. I would say we have a window of just a few months once the fall rolls around and lawmakers get involved in the campaign and their campaigns, things tend to get forgotten. So this is a great opportunity in the next few months to really make our voices heard. We have, as I said, a great opportunity. Let's make the most of it to improve pain care for everybody living with pain. So I will take questions of anyone. You can write in your questions in the panel, and Emily, who's watching those questions, will let me know what some of those questions are.
Sure. So this is Emily Lemiska, Director of Communications. So again, just type questions into the little panel at right, and we will go through them and try to answer them the best we can. If you do have other questions and we don't get to them, you can always email us at contact@uspainfoundation.org. So let's see. So one of the first questions we have is from someone who says, if the CDC isn't going to change their guidelines, does the report make room for other modalities like massage therapy to be more affordable or accessible?
Okay, so first of all, it's my view that the CDC is unlikely to change the guidelines. Never say never. They actually issued a well, let's just say a clarification is what they call it in the New England Journal of Medicine, that basically didn't change anything, but just acknowledged there were unintended consequences for people living with pain. So, I'm not saying that CDC will never change their guidelines, but I would say it's highly unlikely given that there wasn't a strong statement about that in the report. So to get back to the central point of your question, which is, are other things going to be covered? So that, again, is a point of advocacy. I don't think that insurance companies on their own are going to volunteer to cover these other therapies. It's going to come because we make it happen. And so, as I mentioned, our opportunity really right now lies with CMS, because if the Center for Medicaid and Medicare, which does cover health insurance for many people living with pain, those that have the most severe pain and are disabled by their pain, are covered by Medicare and might also be covered by Medicaid. And they are actively considering what else they can do for pain management. If you watched the last meeting, Dr. Sherry Lang, who is a Deputy Chief Medical Officer for CMS, was there. We have some help with the Support Act asking for reconsideration of their payment strategies at CMS. So I think CMS is getting a lot of pressure to cover more than they currently do, and it's highly likely that they will move in that direction. We will have input into that. So this action plan that they're supposed to create will have a public comment period, and that's our opportunity to talk about things that matter to us. What additional therapies do we want covered? And if CMS does this, which I think it's highly likely that they will, then often other private insurers follow suit. They typically fall in line behind what CMS covers. I'll also say that the jurisdiction for insurance accreditation is a state matter. So many things pertaining to pain have various controls and jurisdictions. Some of them relate to what the federal government can change, and some of them relate to what the states have jurisdiction over. And insurance coverage is actually something that states have jurisdiction over. So you can get active in your state with your state lawmakers and have them put pressure on the Division of Insurance in your state to cover more things. So there's lots of opportunities for you to advocate for coverage of additional therapies.
Great, thank you. So we have gotten a couple questions asking if the slides will be available, and we can definitely send those out after the fact, if that's okay with Cindy. Is that okay with you?
That's fine. And also, I think people can access this presentation again. The recording, including the recording, will be available at the US Pain website.
Exactly. Okay, so another question, it's kind of a detailed one. Is there any prospect for Congress enacting a major change in policy for drug enforcement authorities along the lines of the AMA Resolution 235 to repudiate the CDC?
Okay, so regarding that question, that's one of the ones that really falls into this, I think, different jurisdiction than Congress. So medical practice is really controlled at the state level. So whether or not a physician gets disciplined typically resides with their board of medicine. And so while Congress has control of the DEA is not the only one that has been bothering physicians. And so, in our state, the Board of Medicine controls who gets disciplined by their board, who has the ability to take their practice license away. And so, potential avenues to have that resolution become regulation are the Federation of State Medical Boards. That would be a good organization to advocate for medical board changes. Your specific medical board, because every state medical board, I believe their hearings and meetings should be open to the public. Also, there are public members on the medical board. You can certainly contact them and speak with them. I think the biggest avenue for that recommendation, in my opinion, is with state medical boards or with the Federation of State Medical Boards, who have weighed in on pain policy many times in the past. That would be my recommendation. As far as Congress goes, I think it's highly unlikely that Congress would wade into that arena and make a law out of the AMA resolution. I don't think that's going to happen. So that would be my recommendation.
So we're getting a lot of questions about the DEA actually, and people sort of asking if you think that the report will help maybe change how the DEA approaches pain doctors and opioid medications.
I'd have to give that some more thought about ways to influence the DEA. They're kind of a black box. They don't speak often. And I have not had, direct interactions other than hearing some talks of DEA representatives. So, um, I don't know. I have to give that some more thought as to what kind of control uh, we could have on DEA policy. Um, so let me give that some more thought, and maybe if you can, um, I could address that in a later point regarding the DEA.
Okay. So we're getting a lot of excellent questions here. Someone else is asking about whether the report tries to distinguish between acute and chronic pain. They're talking about how they are on chemo and have chronic pain, and they're concerned about a lack of distinction in that area.
Yeah, so the report does distinguish between acute and chronic pain and does talk about recommendations for acute pain, sort of subacute pain, and chronic pain. Um, and also, one of the other things the report, one of the recommendations addresses, or a few of them address, is when a chronic pain patient has acute pain of another origin. And so, for example, I know that a lot of people with chronic pain have difficulty when they have surgery and they've got acute pain on top of chronic pain and they're already being maintained on a number of medications. How does that then come into play when they have acute pain? So there is a piece of the report that addresses that, and there is a recommendation for that as well, because I often get a lot of emails about that situation, and unfortunately, it's not well understood. Oftentimes, people will bring this issue up with their surgeons, and then when it comes to actually pain relief after their surgery, it's not taken care of well. And I've heard some not good stories about this, and so right off the top of my head, I can't remember which recommendation that was, but I think it's incredibly important for you to meet with your surgical team beforehand and have them speak to your pain physician or whoever um, prescribes medications for you, so they really understand that you need to be maintained on the pain medication you have, and you may need more and different medication on top of your regular medication. So it's a complicated issue. They don't, surgeons don't do incredibly well with pain um, long term, and so they're not that familiar with it. I think it's up to us to really advocate for ourselves.
Great, thank you. And it seems like the report does a good job of really making a distinction between long-lasting pain, and it talks about pain as being its own disease with a lot of, far-reaching consequences. So that seems positive.
Yep.
Another question we have is, what do you suggest for patients who are being denied medication now? And should they be contacting their state medical board or the state department of health? Is writing in on this report going to help with that? What do you
So,
think?
I mean, the first thing I would say if you're being denied your medication is to pick up the phone and call your representative in Congress. Literally, this is the time. They need to hear from all those patients out there that are being treated the way they are. The only reason why FDA took the action that they did to issue a warning is because people contacted the FDA. And so it's really important for you to speak up to your representatives, both your state representatives and your federal representatives, your senators and your representatives, because they need to hear your story. You need to call and ask them for help because, in my way of thinking, it is policymakers who have created this difficult situation for physicians, and they don't understand they're affecting the lives of people living with pain. And so my first recommendation is just pick up the phone and tell your story. We need more people to do that. I always go back to the example of AIDS patients and the amazing way they were able to change huge parts of the government. They got huge amounts of money to research, and it's because people acted up. They spoke up. They were not quiet. They wouldn't go away. And so we've got to do the same thing. And I really encourage people to do that. So the first thing I would do is pick up the phone and call them. Ask them, do you know a physician? I can't find somebody to take me. Do you know anyone that's taking people with pain? Ask them for help. Get them involved. They are, working for us. If they're a part of creating the situation, they need to be a part of the solution. And I would say you have every right to call up your representative and tell them what's going on.
Thank you. I think that hopefully will help a few people who have asked questions that are similar. This is a really good question, I think. This woman is asking, are there any current studies going on with pain patients for using alternative therapies like massage and all that other good stuff? And she's concerned because private insurance companies won't cover it without any sort of proof. So does the report address that concern at all?
Yeah, the report does talk about research, but there are already initiatives going on. So the CMS and NIH has a big initiative looking at acupuncture for back pain. And so they're in the process of collecting a lot of data on that. Also, Congress allotted funding for the NIH to initiate it's called the HEAL initiative. And that was a substantial budget increase and for pain research. So there's about $500 million, 250 million going to substance use disorder research, and 250 million going to pain research. So that was a huge influx of funding for NIH in fiscal year 18 and 19. And so as part of that, NIH has initiated many requests for proposals on various types of studies that they're doing, some of which are practical studies like what you're speaking about. I know PCORI is another quasi-government agency that is doing a lot of effectiveness studies on alternative therapies. And so if you go online and look at both of those organizations, you can find out more about the work they're doing in this area.
Great, thanks. There's sort of a few questions we're getting from people who seem to feel a little discouraged about whether or not this report can actually create change for pain patients. And so I was wondering, could you sort of speak to, what's your best case scenario of, if Congress pays attention to the report and, takes steps to implement it somehow?
So my best case scenario would be that there be a hearing on this report, and it would be in the next few months, so during the summer. And Dr. Singh and perhaps members of the task force and patients living with pain would have the opportunity to speak about how pain has affected them and what the recommendations are in this report. That Congress would seriously address the report, put pressure on CMS to cover more things. I know there was interest in the CDC guidelines and their effect at the hearing in February. So one possibility is that they get addressed, and potentially if Congress is involved, they absolutely have the power to have CDC revise them. So that would be another positive outcome. I think also there are many parts of this report that with funding from Congress could make a lot of changes in pain care. And so many of these things, could be initiated by Congress if they were involved and interested. So, there's a possibility that Congress will do another opioid um, potential bill in next year, particularly since we're coming to an election year, and they like to have these bipartisan bills that they can all claim credit for. So there is that possibility, and a robust pain section, and that would be really great. Um, I know Senator Alexander is working on a health care cost bill. I tried to make the point to him and others on his staff about the importance of pain. The pain costs us $600 billion a year. That's an important number to use when you're talking to your lawmakers about the cost of pain and the number of people affected by it. So certainly better coordinated care in pain would help bring our healthcare costs down. There's an opportunity there to make a pitch for putting some of these recommendations in to that bill. So there's lots of opportunities. It's a matter of us really pushing for them and really initiating them. Um, you know, it's the squeaky wheel that really gets the attention. And I can't say enough about how important it is for us to contact Congress about pain in this report and the effect that the current climate has had on your life.
Thanks. We're also getting a few questions from people who say they have tried contacting their representatives and they either haven't gotten back or they've gotten just kind of a a format reply. Do you have any tips for people to really get their representatives' attention?
Yeah, pick up the phone and call. So sending emails is helpful, but they get a whole lot of emails. So I would call. You can call the local office or you can call the Washington office. Their numbers are right available online. I would ask to speak to the health policy aide in the office. I would get the name of the health policy aide in the office. If the person is not available, get their email, email them your concerns, ask for them to talk to the representative and get back to you. If they don't get back to you, follow up. Keep contacting them until they take your call and listen to you and get back to you. So that's one avenue I would use. Now, everybody has at least 3 representatives in Congress. So you have your House representative and you have 2 senators. So there's 3 possibilities of staff who you can contact and be in touch with. And the other thing is getting other members of your household or your friends or your family, whoever else lives near you, to contact those same representatives with the same concerns. And if they start hearing from lots of people with these concerns, um, they will act. If anybody watched that hearing, I remember that some of the senators in the HELP hearing, in particular Senator Murkowski, talked about the number of constituents that she had heard from who had serious pain and were unable to access either their medication or unable to access a healthcare provider to help them. And she was very impressed by that. She talked about the large numbers, and so that's what matters. And she was very interested in hearing about what could be done about it. And so that was on her mind. I've actually even seen the video clip on her own website. And so you'd think that she'd be interested in addressing this. So if you live in Alaska, I would strongly recommend you contact Senator Murkowski.
Great, thank you. And I think you're so right about getting family members and loved ones to write in. For better or worse, that seems to make sometimes a bigger impact than the patient themselves, which is a little bit sad almost, but it helps. So let's see, we have a couple more questions that we can take before we wrap up. One is about whether this report could potentially help change state policies that are, creating restrictions around pain care.
So, again, this report needs to get known about. And that's why I thought a congressional hearing is really a big deal, because it gets covered in all the media. But you can help make that happen. So you can, for example, contact your commissioner of public health in each state. There's some sort of we call it a commissioner. I know some states might have a secretary um, of Health and Human Services, or there may be both a Department of Public Health commissioner. But in any case, there is an official at every state who is in charge of health policy for that state. And I think it'd be important to contact their staff and send them a copy of the report and tell them about the report and how important it is. Some of them may have actually heard of it in my state. They're quite aware that this task force was working. And because of the opioid crisis, most people's ears are open to knowing what's going on in particularly out of the CARA legislation. So I think it would be important if you say this was a piece of the CARA legislation. Any state health policy person would know about that, because there were block grants to states as part of that. And contact your commissioner of public health, make sure they know about the report. Contact your state lawmakers, make sure they know about it. See what's going on in your state relative to pain care. States are a great avenue for advocacy as well.
Great. Just a couple more questions. So someone was asking whether it makes sense to try to reach out to like the media to let them know about the
Yeah,
report, about their story.
absolutely. If you know reporters in your area, if you have any relationships with reporters, if you have their contact information, I think this is incredibly important. Um, you know, FDA was very public about the warning that they issued a few weeks ago about pain patients that are being dropped from care, pain patients that are being denied their medication. That got picked up in the media. There was that, and also the CDC guideline article in the New England Journal of Medicine got coverage as well. And I know those stories were carried locally. What you could do is contact those reporters and say, these are the problems that were pointed out by a lot of people contacting the FDA and the CDC and HHS, and there's a report that addresses this. This report was mandated by Congress, and it's incredibly important. And let them know about it. The final is supposed to be released May 30th, and it is my guess that HHS will do some sort of a press release or a press conference around the final report, and that will be covered. That's a great opportunity for you to contact reporters in your area, make sure they're aware that the final will be released on May 30th, and that might get coverage. Get yourself interviewed, say you're a person with pain that's been involved in these issues. So the more you can get media attention to this, the better. And a great place to, opportunity to get media attention is when the government makes a large announcement. So my guess is that I haven't heard about specific plans, but I know the report will be released May 30th. If you're connected to an organization, you can issue a press release on May 30th when the final report comes out. That would be great too. So any publicity you can get is helpful.
Okay, thank you. So I think that's it for questions. If you have a question that you would like answered and we didn't get to it, please feel free to email us at contact@uspainfoundation.org, and we'll do our best to help you. Also, just a reminder that we have those 2 action campaigns, and the handout is available under your little control panel and clicking on the little triangle, and then downloading that so you have the links right in front of you. But Cindy, thank you so much. And I just wanted to let you know that there were, besides the questions, there was a lot of people saying thank you for what you do, knowing especially that you have back pain, and, it's not easy to get out there and work on this. So thank you.
Sure, and thank everybody for tuning in. And remember, your voice matters. Speak up. I really encourage you to get active and advocate for better pain care. So thanks everybody for tuning in.
Thanks all. I'll close down in about a minute. Just give people time to download those handouts if they would like. So thanks again for tuning in.